This practical on the front limb muscles is to show the various groups of muscles that are working in antagonistic groups. And what we mean by antagonistic groups is the fact that a muscle can only contract, and therefore if one muscle brings the leg forward, that's a protractor, another muscle must be a retractor, that would be the latissimus over there. So they all work in antagonistic groups. And the protractor in this case is then the brachiocephalic as well as the omotransversarius muscle, and the retractor there is the latissimus dorsi. So when that one contracts, it would bring the limb backwards. Then the same principle of antagonistic groups apply then to all the muscles that form the shoulder girdle muscles, and that is the muscles that attaches the front limb to the body. So let's do them in sequence, and let's start then with this one over here. That one there is the trapezius, and underneath it is the rhomboides. We cannot see it very well, but I'll open up here, and with the assistance of Dr. Lariche, that is the rhomboides over there, and there's also a part in front. There's another part in front of the rhomboides. So the rhomboides, if it contracts, it is an abductor, so it would cause the leg to abduct like that. The antagonistic muscle for the abduction are the pectoral muscles, and there are two of them here, and they adduct the leg. In other words, when they contract, they adduct the leg. Then the last one that we have to do with regards to the front limb muscles is the serratus ventralis, which extends from where my finger is there to there, and I'm going to ask Dr. Lariche to put a hand in there. And if I put my hand in here, then our hands meet, and then you can see that the attachment is on the deep side of the scapula where my hand is. So that serratus ventralis absorbs the weight of the animal. If you can look at when the muscle takes tension, so the front limb, or the front part of the animal, that is the 2/3 of the body weight, is carried by the serratus ventralis. It also has a lesser function with regards to protraction and retraction. All these muscles then of the shoulder girdle that we did now, they are called the synsarcosis because they attach the front limb by muscles only. In other words, there is no synovial joint, and they form what is called the extrinsic muscles. In other words, they move the leg around, but not the joints inside the leg. We will do them just now, and these muscles on the inside are called intrinsic, whereas they are the extrinsic muscles. The intrinsic muscles of the front limb, they extend or flex the joints like the shoulder joint, the elbow joint, carpal joint, and digital joints. In other words, they have effect just on these joints and not on the movement of the leg. Now, the nerve supply of the extrinsic as well as the intrinsic muscles come from the brachial plexus, which you can see come from that position over there, and it splits into quite a few branches. I'm not going to do the detail of that now, but these different branches supply then just about all the extrinsic and intrinsic muscles of the front limb. Starting then with the individual muscles of the front limb, which are intrinsic muscles. Let's start here. The supraspinatus is that muscle there, and its function is to extend the shoulder joint. The infraspinatus is that one over there, and the infraspinatus and the supraspinatus, as well as the subscapularis on the ventral side or the deep side of the scapula, they form the variable tension ligaments of the shoulder joint because they are not collateral ligaments over there. Then the true flexors of the shoulder joint, one that I've got here dissected is the deltoid, which has got two parts over there. Then the other muscles that cause flexion of the shoulder joint is the teres major and teres minor, which is not dissected, so I cannot show them. They are lying deeper. Then the muscles of the elbow joint. Firstly, we have the extensor of the elbow joint, and that is the triceps muscle. whereas the flexor of the elbow joint has two muscles. That one there is the brachialis, and I'm going to lift it up and ask Dr. Lariche to hold the leg for me. And that one there is the biceps. So my fingers go underneath, in this case the brachialis, that case the biceps brachialis. So they are the flexors of the elbow joint. Okay, you can let go. So the flexors cause flexion, the triceps muscle cause extension, and they form an antagonistic group. The next joint that we have to consider is the carpal joint. The extensor of the carpal joint is this muscle here, the extensor carpi radialis. And then the flexors, we find them on the caudal side. There are two of them there. The extensor carpi ulnaris and the flexor carpi ulnaris, they are the main muscles for flexion against the extension. Then the next level of joints are the metacarpophalangeal joints or fetlock joint, and further down. Here we have the common digital extensor and its tendons, and you can see the tendons run on the cranial side and go right to the last phalanx in that case. And the lateral digital extensor, we don't do the detail of the insertions there, but they are the digital extensors. Then the digital flexors are these muscles here on the caudal side. There's a superficial and a deep one, and I want to show you the superficial and the deep separation where they insert. So they flex their digits, and then additionally, and the last one is the intraosseous medius muscle, which inserts via the sesamoid bones onto the proximal end of phalanx 1. As you can see, it is purely tendinous. There are no muscle part in it. So when the fetlock overextends during normal standing, it takes most of the strain. So it cannot actively flex that joint, but it takes the strain as the passive structure that prevents further overextension.